This is just a quick guide on how to verify death. It is quite common when you're on call, you're being asked to verify death whenever a patient has passed away. Hello, hi, I'm Dr. Nura. Welcome to my YouTube channel. So first thing you need to do is know whether the death is it expected or unexpected, and check the resuscitation status. Make sure the patient has DNA CPR before verifying death. And then just ask the nurse what happened. Was there anybody with the patient? Was the nurse with the patient? Was the patient comfortable during that? And then always try to verify death as quickly as they can before they go into rigor mortis. If the family and friends are present when you go to verify the death, then make sure to offer condolences to them and explain the need to verify death to the family. Offer the family opportunity to stay or leave depending on what they prefer, and check whether the family have any concerns or questions. So the first thing to do is obviously wash your hands and put the relevant PPE. Check the identity of the patient either by wristband, checking the name and date of birth. Make sure that you have the correct patient. The first thing that we do normally is check for any signs of life. So look, listen and feel. So look for any signs of respiratory breathing, feel for the carotid pulse, and listen for any breathing sounds. And then after doing that for about 10 seconds, and then assess the patient's response for any stimuli to speech, pain, reflexes. Shine the pain torch to the eyes. After death, it should be fixed, dilated, and non-reactive to light. And then no response to voice, obviously. And for the pain, normally we do a sternal rub or pressing on the supraorbital pressure. With no response, then we proceed with auscultation. So we'll listen to the heart sounds and then listen to the breathing rate. There's no specific guidelines, but normally I usually do about heart sounds for about 2 minutes and the respiratory rate for about 3 minutes. Basically what they say is you should generally agree about 5 minutes is enough to establish the cessation of any cardiorespiratory effort. So after completing, then I usually like to just have a quick look around, see if the patient has any catheter or any rashes or anything like that, and then cover the patient, make sure patient's dignity is preserved, and then document your verification of death. Normally I'll just document whatever I've done. Basically no signs of life, pupils fixed dilated, no response to pain or voice or carotid pulses palpable, and then no heart sounds noted and no breathing sounds, and they're confirmed at this is so basically after completing the examination, that is when death is confirmed. Document as well no concerns from staff or any family members. It's a good practice to just document just for the cremation form purposes, just in case patient is for cremation, whether is there any pacemaker present, and also was there anybody present during death. If there is staff nurses present or family members present, then it's best to document them as well. Just inform the nurse that you've done it, and then they will do the relevant things. As a GP, normally we have to verify death mostly out of hours, but there are some instances that I have gone and verified death during work hours where a patient is expected death. So always consider if the death needs referring to coroner, but normally this is all noted during when you do the death certificate. So not necessarily when you do the verification death you have to complete death certificate. It's normally the doctor who look after the patient usually completes the death certificate. And also even in the GP land, it's always the patient's usual GP completes the death certificate. If the patient passed away during out of hours or weekend, then the out of hours doctor will be called to verify the death. And then after this is done, then we normally advise the family to contact the GP. Their own GP will complete the death certificate or cremation form as necessary. And when they do that, that's when they think about referring to coroner if needed. If you would like some advice on how to complete death certificate, then please leave a comment below. Otherwise, here's some videos about how to read chest x-rays.